so you'll get a little flash on your screen. And just a reminder to, if you don't want to show up on the video, just to mute your videos. But a warm welcome to our Ontario Health Team Engagement Learning Series. This is session number 7. We launched the session several months ago, and we've been offering one session a month. And it's been so enjoyable to work with so many partners to co-design the series and to deliver the series. And today we're focusing on a really important topic, which many of us are digging into, on evaluating your engagement activities. And so the objectives today is to really, as a group, to really learn and listen and hear about what some of the other OHTs are doing regarding their evaluation activities. And you'll hear some examples in our fireside chat panel. Dr. Julia Abelson is going to talk about why engagement matters and some things that you need to think about as you embark on those activities. And really, we want to instill a learning mindset and curiosity within the group, and to think about how you might approach these activities within your organizations and within your Ontario Health teams if you're part of an Ontario Health team. So I'm Carrie Koleski. I'll be facilitating the session today. I'm from the Institute for Better Health at Trillium Health Partners, and have really enjoyed pulling the session, these series together and working with so many fantastic partners. So warm welcome. Next slide, please. And so just a few housekeeping items. Again, we are recording the session today, so please mute your videos if you don't want to show up, unless you want to show up on the video. And feel free to introduce yourself in the chat. You can put your name, your OHT, your organization that you're part of. And also you might find the chat helpful. You might also find it a bit distracting. So if you'd like, there's a little trick. You can go to the bottom of your screen. There's a little arrow beside the chat feature, and you can click on the little arrow to unclick show chat previews. And that way the chat won't show up as a pop-up. So just wanted to give that last bullet point on, you can read that. It shows you how to mute your chat. Next slide. And land acknowledgement. So I know we're all joining from different places across Ontario and possibly across Canada as well. And I represent Trillium Health Partners, which is based in Mississauga. And we acknowledge that land on which Trillium operates is the treaty lands and territory of the Mississaugas of the Credit First Nation. It is also the traditional territory of the Huron-Wendat and the Haudenosaunee. And the land and lakes in this region continue to be home to many First Nations, Inuit, and Métis communities from across Turtle Island, which is currently known as North America. So warm welcome from the land that I'm presenting from today. Next slide. And so, as I mentioned, the series today is part of a larger series that are all really interconnected. If you go onto YouTube and you type in patient experience team, or click on the link that Junie just put into the chat, you'll see a number of videos that features each of the sessions that we've developed for this learning series. There's a pre-module, which introduces the whole series and provides background on frameworks and concepts related to engagement and co-design. And then we get into a number of sessions related to communication, compassion, and empathy, how to have difficult conversations, how to share your story and receive your story, equity, diversity, and inclusion, and many other sessions. We have some on co-design, preparing for co-design, actually doing co-design work, and today on evaluation, which will be posted after the session. What's really important about this is this interconnected series gives you a full scope and training on how to prepare for working in partnership, and then how to do the partnership work over time. So it's worth revisiting. There's a workbook that accompanies each of these webinars. And if you need copies of these workbooks or you need direction to the site, feel free to reach out to me. Junie will put my email in the chat, and also you'll get a follow-up email from our group. But really the intention is for people to reflect on these sessions and to work with their teams and partners to dig in even further. So the workbooks will have things like how do you listen authentically, how to prepare for sharing or receiving a story, and it provides some really specific guidance on what that looks like, and it's activities that you can do with your teams. So I'll leave it there for now, but just want to point people to the larger series and huge acknowledgement to the patient, family, partners, community members, faculty, students, trainees, leaders who helped to pull this full series together. Next slide. And so the workbook for today's session in particular, and the workbook was emailed out, but we'll send it out again after the session, is divided into a number of sections, and it defines what we mean by evaluation and what it matters. So we have a section on the definition and why it matters. Then we talk about, the different ways of evaluating engagement activities. So we provide examples of frameworks and reflective questions that you could ask with the groups that you're working with to assess your engagement activities. And there's a number of easy to administer surveys, many of them developed by Julia Abelson and her team, and also a toolkit that was developed by Julia Abelson and many community partners, many of whom are probably here today, that's focused on planning and conducting evaluation activities. And there's other OHTs that have done a tremendous job pulling in and providing resources. Some are highlighted in the workbook, but if we missed important resources, and I know we did, please feel free to reach out to me or put a link in the chat so we can share with others other resources that are out there related to evaluation. Next slide. So for today's session, we're going to start by launching a quick poll just to see who's in the room and get a sense of the different participants that are here today. And then I'll introduce and then hand it over to Dr. Julia Abelson, who will provide an overview of the fundamentals of evaluation for health systems. And then I'll have the pleasure of moderating a fireside chat with a panel to dig into some of the specifics, and I'll introduce the panel when we get to that stage. And then we have a few wrap-up Mentimeter questions for you to reflect on at the end. And I want to draw your attention to 2 drop-in series feedback sessions that we're going to be hosting on Thursday of next week, and then one in July, just to get a sense from people that attended one or more of these sessions. We want to learn what worked, what didn't work, what are your outstanding learning needs. When we launch a 2.0 version of the webinar series, what will that look like? What should we consider? How can we structure that? So the drop-in series, you can sign up for one of those if you're interested. And, it's pretty informal. We'll have some questions that we'll reflect on together to get a sense of how you experience the learning series overall. Next session, or next slide. And so actually we'll pause it there because I'm going to introduce the panel when we get to that stage. But first I want to introduce Dr. Julia Abelson, who I'm sure many of you know. She's a professor in the Department of Health Research Methods, Evidence and Impact at McMaster University, and a member of the Center for Health Economics and Policy Analysis, and lead of the Public and Patient Engagement Collaborative. Throughout her career, Dr. Abelson's research program has been guided by a long-standing interest in how the public interacts with health systems as patients, community members, voters, and taxpayers. These interests have provided the foundation for numerous research studies focused on the design and evaluation of processes for engaging the public and patients and health system decision-making. Through her research, she has developed productive and long-standing partnerships with a wide range of policymakers and health system managers at the provincial and regional governance levels across the country, and is regularly invited to advise policy decision makers and health system managers on the design, implementation, and evaluation of public engagement processes, and has developed so many amazing tools in this space. One thing I forgot to do, because I got ahead of myself, is we need to launch our poll and see who's in the room. So before I formally hand it over to Julia, I want to see who's in the room today. So you'll see a poll that's just come up on your screen. So it looks like we have about, I'd say, 50% patient or caregiver partners, many of whom are part of an OHT. We have just under 40% staff at OHT or other organization. We have a few clinicians, handful of researchers in the room. This is great. And I'm not sure if people could see. So if we end the poll, you should be able to see the results. Perfect. Yes, we have a nice mix of individuals in the room today. And so we can close that off. Thank you for participating in that. And Junie, after Julia finishes her presentation, we'll go back to this slide when I introduce the panel. So we might go back in the deck a little bit. But I think we're good to move on. And I warm welcome to Julia. Thank you so much for setting the stage for our talk today.
Thanks very much, Carrie, and it's a pleasure to be here and exciting, right, to be involved in the last of this series. So we'll be interested to get some of that feedback over the next few weeks. I'm going to be doing the theory burst, which I think has been a regular feature of these learning sessions. I'm going to talk broadly about how to support engagement work through evaluation. Next slide, please. And I'm just wanting to let you know, when Carrie introduced me, she gave kind of my formal academic affiliations, which is fine. But I think in relation to this presentation and my role here today, it's really as lead of the Public and Patient Engagement Collaborative, which is most important. And again, in particular, noting that we're one of the OHT implementation support partners. So all things related to engagement, patient, family, caregiver engagement, community engagement, and in particular, as you think about how it can support your work around evaluation, we are very, very willing and able to help you with that. So just put a link to our website at the bottom. Next slide, please. So two key objectives for my part of the presentation today, before you hear from the panelists, really to discuss the role of evaluation, as Carrie said, right, as a way to support your engagement work. And in particular, to start to kind of introduce you to and provide an overview of the different tools and resources that can help you with that work. So two fairly straightforward objectives. And again, I think we're going to hear very practical tips and advice and guidance from our panel members. This is just to really kind of act as a primer and to get you started to think about this. Next slide, please. So I put this slide up in a lot of my presentations on this topic because I think it helps us kind of really make that compelling case for why evaluation is so important in this particular area. So this is the title of an editorial that I co-authored with colleagues who are very, passionate and very active in this area. And if you can see the subheading, underneath the title, if we're serious about involvement, we need to be equally as serious about evaluation. I think that's really the key message that I want to convey to you, right? You're spending a lot of time in your OHTs and partner organizations thinking about engagement, thinking about how to do it well, who to involve, all of these great things. So why wouldn't you take the next step to think also about how you're evaluating or assessing or collecting information to understand how well you're doing, right? This really, really important foundational work. And I think most of you would, have a sense that many things we do, we're evaluating, right? Any kind of work in our, attempt to improve health systems, to do that really important integration work, we're always evaluating, right? So why wouldn't we be thinking about evaluation in the sphere of our engagement work? Next slide, please. So given that, again, if we're kind of embarking on this and recognize the importance of it, that doesn't mean it's not challenging to do. And there are a lot of things to think about as you start to embark on this work. So I think one really important message that I'd like to convey early on is this idea of different people who are involved in evaluation and engagement work may have different goals for that evaluation, right? So if we think about all of the different partners who are involved in even designing and implementing or even just being involved in engagement work, and they may then in turn be involved in the evaluation, they may come at it from different perspectives. So I tend to think about, a number of different types of questions that these different stakeholders may ask. So practitioners, and by that I mean maybe those who are designing and implementing engagement, the engagement processes, may be asking questions of more formative evaluation questions, how well we're doing, how can we do better, how do we show the impact of our work, right? Just kind of continuous learning and improvement questions. while patients, families, and caregivers might ask different questions. They may ask those important questions as well, but they may also be asking things like, are my contributions making a difference? Is this a good use of my time? Are they doing anything with the input, all of the work that I'm contributing, all of the time I'm spending in this, in these activities? What's happening, as a result of it? Researchers like me often ask questions, more technical questions about what works, in what context, with what outcomes. And then funders and sponsors may have different sets of questions as well. Are we achieving our goals? What's our, that important return on investment question? And what successes can we point to? So I think important to realize that we may all agree about the importance of evaluation, but we may have different goals for that work. Next slide, please. And so a couple of other key messages. So how do we think about using evaluation to support our engagement work? Well, I think one, most importantly, it can just help us at the very, very early stages in setting goals and benchmarking, right? This idea of early on, even asking these really important foundational questions, what are we actually trying to achieve through our engagement and partnering work? I think we're all sometimes kind of rushing to do the work, the engagement and the partnering work, and we sometimes forget to step back and say, what are we actually trying to do here? What are our goals? What outcomes are we trying to realize here? Or maybe more kind of formative again, where are we now? Where would we like to be? What do we want to see a year down the line, 3 years down the line? What do we want to be able to say we've achieved through our engagement and partnering work? I think it can also support continuous learning improvement, that kind of formative work of let's just measure kind of as we go, how well we're doing. What is our PFAC, looking like? How well are we doing with that particular structure? The more ad hoc engagement processes. So that important continuous learning and improvement evaluation work. And then further down the line, thinking about that assessment of impact. So again, with all the inputs, right, all the resources we're putting into our engagement and partnering work, what are we getting out of it? What are those impacts that we're achieving? What are the success stories, or maybe not, sometimes some stories about failures or things that didn't go as well as we hoped it would. So 3 key principles to think about here. Next slide, please. And so when we think about where we are with engagement evaluation, there has been certainly, and Carrie mentioned this, there has certainly been a lot of attention to this and an expanded level of attention to this over the last number of years, for sure. I think as we become more comfortable with the type of engagement work we're doing and the processes or the approaches that we're using, we're now starting to look at questions about impact or about how well we're doing in this space. But I think we're still at a very early stage, particularly around this whole idea of measuring impact. Measuring impact is really hard to do. I always say if people knew, if it was, quite easy to do, we'd have had all kinds of articles and, evaluations undertaken to kind of figure out how well we're doing in this space. If it was easy to do, it would all be there. It's not. It's challenging, it's hard work, and it takes time and resources, and organizations need to think, I think, in very deliberate, intentional ways, and even in strategic ways about how to tackle this whole question of measuring impact. And I think also important to think about the need to think creatively and strategically about the different approaches that you use to even collect your evaluation data or collect information to help you understand how well things are going with your engagement and partnering work. So we often think of surveys and interviews maybe first and foremost, but there are a number of other approaches that we can use that I'll speak to a little bit later, and maybe some of our panelists will speak to as well. Next slide, please. So 3 key points before I move on to the next set of slides. So, think really clearly and specifically about these 3 pieces. What are our goals for evaluation? So take that time at the beginning to think about not just designing the survey or the interview or asking people what they think, but like, what are we actually trying to achieve? So be really intentional about this. What aspects of engagement are we evaluating? You may not be able to take it all on. I can say probably with some confidence, you won't be able to take on all elements of evaluation. And I think we're going to hear from one of our other panelists about this issue of how do you get started even? And part of that is thinking about, maybe a set of priorities for our evaluation work. And then what are the most appropriate tools for the job? So thinking about goals, thinking about what we're evaluating and what are the what are the most appropriate tools for the job. Next slide, please. So with that, I'm going to introduce you to some of the tools and resources that are available. And I think some of you may be quite familiar with some of these tools, but I know that many of you are at different stages in thinking about evaluation and starting to tackle this area. So I want to make sure we're all on the same page. This is just a way of showing kind of more chronologically that there have been more and more tools introduced to the health system sector and the health research sector. And I think that can sometimes be a little bit overwhelming. I often hear from people who are asking for help and support and guidance. Just tell me, which one is the most useful for me for what I want to do, or there's so many out here, I don't know where to start. And sometimes people can feel a little bit paralyzed and not be able to take that next step or that first important step along the way. So just to show you, there is a lot out there, but hopefully with the way I move through this over the next few slides, and then what you hear from others today, you'll the kind of the mystery around this will be diminished. So if you move to the next slide, I'm going to focus on two evaluation resources that I know well because they were developed by my team, by the Public and Patient Engagement Collaborative. So the first is the PEAT, and we keep the second P silent. I know sometimes I hear people calling it the PAPEAT. I know that makes sense based on the two Ps, but we'll just call it PEAT. And so that is a tool that was first released 8 years ago now and was revised and re-released in 2018 to reflect kind of a lot of the changing practices with engagement over time. And then the other one, which is our newer one, the Engage with Impact Toolkit, which was just released last year. So I'm going to walk you through each of those in turn. Next slide, please. So the Public and Patient Engagement Evaluation tool really was developed in response to calls from our engagement practice community. Many practitioners across the country, in fact, this was a tool developed across the country with contributions from people from a variety of organizations across health systems and throughout our provinces and territories. And there was a real kind of call for something simple, easy to use to support public engagement, patient engagement programs, and in particular to make the case for their engagement work. Some people came to us and said, we're worried about losing the resources, the support for our patient engagement program. We want to be able to show that, what our work does and how it works and how it can actually contribute to the overall organization, to achieving the goals of organizations. So that was very much from the field itself, not an academically kind of initiated exercise, but actually calls from the engagement community to help us develop something that would be usable and user-friendly. And so that happened over a number of years. And again, as I said, version 1.0 released in 2015 and 2.0 with new modules, revised guidance in 2018, available in French and English and translated by us, but also subsequently as many more people have been using it around the world. Really exciting to see how many different languages it has been translated into. Next slide, please. And again, a freely available downloadable tool that you can access through our PPEC website, comprised of 3 questionnaires: a participant, or kind of the engagement for the person who's being engaged or doing that important engagement work, contributing. Project questionnaire that would typically be responded or completed by engagement staff. Often we hear people say it's really helpful almost as a planning tool or guide because it kind of walks you through all the core principles of designing a good high quality engagement process. Has 3 modules: the planning, assessing, and assessing, formative assessment and impact assessment component. And then this other organizational questionnaire, which may be something to keep in mind for some of you, kind of gets more at that high level, strategic level, like how are we doing with engagement across the organization or across our team and our partner organizations. So gets at things like, supports in place, capacities, what are the policies, what is the kind of even awareness of engagement work throughout the organization. So key points here. A tool comprised of 3 discrete questionnaires that would be completed by different respondent groups and even different modules within certainly the first 2 questionnaires. So a little bit of navigating to figure out what makes the most sense for you for your particular goals and your context. And I think anytime, I mean, I would want to reinforce this, and I think Laura, my colleague Laura Tripp, is doing this in the chat too, to some extent, is we are here as resources for you to help you use these tools. So if you're at all stuck, not sure how this works, reach out to us. Don't hesitate. We're here to help you with that. Next slide, please. So building on the PEAT. So obviously, really great, maybe 3 questionnaires that help you early on with your work. And I would say that really is where I think the strength of this tool lies, is at early stage activity specific evaluation. So kind of just getting started. It can support that benchmarking I talked to you about, the process evaluations, that continuous learning and improvement work, and some impact evaluation. Where I would say it is not as helpful is to give you that kind of overarching, comprehensive, more strategic level evaluation tool to support more sustained engagement work. So if you're looking at how do we think big picture about evaluation, the PEAT is going to help you, more at a granular level once you get started, but it is not going to help you with that big picture perspective. So that is really why was the impetus for developing the Engage with Impact Toolkit, which, as I said, was released just last year and very much designed for and with OHT partners. So in contrast to the PEAT, the Engage with Impact Toolkit helps with that organization-wide, more impact-oriented evaluation, but of course could include the PEAT questionnaires as key resources for doing some of your early stage evaluation work. Next slide, please. And link to the website here. So I think what's really key in terms of features to keep in mind is that it's comprehensive, menu-driven evaluation resource. So it's not a simple going to a tool or a questionnaire or a survey. It's actually an entire website that actually is modular and walks you through the different stages of planning and implementing your evaluation. Developed, as I said, with a working group of PFC partners, engagement leads, and researchers across the province, and again, designed to support all phases of evaluation and available in French and English. Next slide, please. So now I'm going to kind of walk you through this, and I would encourage those of you who would like to refer to the website. The link is there if you would like to actually just hop on to the website itself and walk through it as we're talking. So next slide, please. So the toolkit is comprised of 5 modules, right? All listed here. And I'm going to walk you through each of them very quickly with the time I have remaining. And then I think as our other panelists come in, we'll maybe think about how we bring some of this alive in our more concrete kind of how-to discussions. Next slide, please. So first module, planning. These are, we often hear people say that this is actually the module that they spend the most time on in some respects, because this is where you're getting started and thinking about how you approach your evaluation. This is where you're identifying your goals, even assessing whether you're ready to evaluate. Sometimes you may actually say, we got some other work to do. We're not ready to jump into evaluation. We'll come back to it when we've done some other key things. So it helps walk you through all of those important questions at the early stage of your evaluation work. Next slide, please. The tailoring I won't speak about for very long, because I think one of our other panelists is going to actually walk you through a very concrete case example where you would use something called a logic model approach to evaluation. This is a very commonly used approach to help you kind of unpack and maybe demystify what can be seen as fairly complicated elements of evaluation. So all this to say is that second module helps you take your kind of high level planning and goals, et cetera, and move to start to tailor and plan how your evaluation will unfold. Next slide, please. This next one, I'm going to spend most of the remaining time I have on, because I want to just walk you through. It's kind of the guts of the toolkit, in that it is where our measurement framework resides. So if you were to go into this module, you would actually be taken into a database, actually, that gives you all kinds of useful information about how to start to pick and choose different kind of evaluation domains you might want to focus on, different levels of evaluation, even the questions that you may want to start to think about populating in either a survey or an interview or in other data collection tools. So I'm going to walk through a few things in this module now. Next slide, please. So these impact levels and domains that I just mentioned, this is really the kind of the crux of what you'll see in this module. On the left, the people, programs, organizations, and health systems is really to get you thinking about what is that level that you're thinking about evaluating at, right? Are you at, thinking about impacts or, perspectives of individuals, staff members, leadership, patient, family, caregivers? Are you looking more at the program level of how are our engagement, how's our engagement and partnering work actually impacting our programs, our services? Or that larger, as I talked about earlier, strategic, more organizational level, or even further down the road, how do we talk about and understand how our engagement and partnering work actually has impacts and influences on the health system itself, or at least the outcomes for our priority populations. So on the right, the domains, and there are 8 of them. And again, this was all generated by our working group and through lots of different steps in our concept mapping process. So we landed on these 8 domains of impact, or domains that would be the focus of your evaluation. Again, not surprising. Some of these should seem quite intuitive to you. You may be interested in the impacts of engagement and partnering on building knowledge and skills or confidence and trust. You may be interested in looking at the extent to which programs and services are designed in more equitable, inclusive ways because of the engagement of patient, family, caregivers in a particular way. Often we think about the ultimate kind of impact of engagement and partnering is, did they change or influence at least or shape the priorities, the decisions, the policies, right, that are made by organizations? So really important domain there. And then the effectiveness and efficiency of programs, potentially being able to look at the level to which engagement and partnering has actually contributed to more effective programming. Patient-centeredness, not surprising, to the extent that you're engaging well, you're engaging really deeply and embedded ways, you would expect to see that the patient-centeredness, right, of your programs and services are improved. And then even kind of, again, organizationally, the culture change, right? To what extent does our engagement and partnering actually, shape or reshape, right, the entire culture of our organization? And then ultimately, it's about, right, having an impact on patient outcomes and experiences. Next slide. So this, and I'm going to work through this very quickly because I know we want to move on to the fireside chat component. But this particular set of slides will now just, these are screenshots of what you would actually see in this module. So for each of the domains that I've just spoken about, you see those on the left under the domain column. For each domain, there is a core item that we have identified that was kind of identified and agreed to by our working group as being really important ways of measuring that domain. So each one of these, and I won't go into them in detail, but basically could be turned into a question in a survey or a question in an interview, helping you to measure what's going on in that domain. And then the supplementary items are there too. If perhaps you're wanting to focus on one area in particular around knowledge and skills or confidence, trust, you may want to do a more deeper dive into evaluation or measurement in some of those areas, and those supplementary items would help you develop the questions to be able to collect data. So we'll just move through the next slides just to kind of quickly show you what it looks like. If you keep going, please. So sorry, the one before, just so people see that, equity, inclusivity, priorities, decisions. So again, I walked through all of these domains, for each one a core item, and then the supplementary items. Next slide, please. Culture change is interesting. Just a quick point on that. We had a hard time settling on one core item only. People felt very strongly that if anything, the engagement and partnering work that they're doing should ultimately have an impact on the culture of the organization. And so that's why we see so many supplementary items. People had a hard time just choosing a small number. So a good kind of array of ways of measuring that particular domain. Next slide, please. And these are our final two, I believe, patient-centeredness and patient outcomes and experience. Again, the further we kind of move out to looking at those longer term impacts, the harder it is to do. And so I would say, in a sense, if you could look at the framework as kind of moving from maybe the easiest kind of shorter term to medium term to longer term outcomes and impacts. And I think I'm wrapping up and just covering the last two modules in the toolkit. So we can go to the next slide, please. Collecting and analyzing, incredibly important, of course. And this is where we offer a guidance about a variety of different types of evaluation data sources and ways of collecting your data. And then the last slide, please, is the refining. So this is incredibly important as well. What do we do with all of our results from evaluation? Who do we share it with? How do we share it? And then what are our next steps, right? What have we learned from our evaluation work, and how do we take that back and turn it back into maybe changes, improvements, and then another cycle of evaluation. So that's it for me. Thanks very much, and look forward to the Q&A and to the next segment.
Thank you so much, Julia. What a fantastic overview to really kickstart the conversation today. So very, very much appreciate you taking us through the foundations of why it matters, how to think about it, how to approach it. You provided really great concrete examples, and I've checked out the Engage with Impact Toolkit and actually worked through some of the modules. It is a fantastic resource, so I highly recommend, if folks haven't had a chance to check it out, please do so. There's lots of really helpful worksheets that you can download and work on with your teams. But without further ado, I'm going to introduce our fantastic panel for our fireside chat. I do want to emphasize and encourage everyone to add questions in the chat. We do have time in a little bit to get to those questions, so we'll be sure to circle back and get your questions answered. But first, I want to introduce the members of our panel here today. So you've all met Julia, and we also were joined today by Kathy Borthwick, and she's a patient and family advisor co-chair for the Chatham-Kent Ontario Health Team. As a patient advisor, she supports the patient and caregiver partners across Chatham-Kent who provide a critical patient perspective and are reflected in decision-making and program planning through the Patient and Family Advisory Council. She's pleased to be assisting in the transformation of our healthcare systems within her region. She leverages her lived experience as a patient and care partner to family members to support patient care partnership across the continuum of care. And the phrase "nothing about us without us" serves as a constant reminder of the importance of a patient and family-centered focus within our communities. And Kathy, I totally agree. That's a driving phrase that I look to all the time. We are also joined by Dr. Reham Abdenaline as a researcher, evaluator, health system planner, and strategist. And before embarking on health services research as her field of choice to pursue her PhD, she was a medical doctor specializing in emergency medicine, a healthcare quality professional, and a medical lecturer. So her passion for evaluation, integrated healthcare networks, and assessing care experiences led her to evaluating health links in Ontario, which many of us will be familiar with, as her PhD project at the University of Toronto. And her role as the Population Health Management and Evaluation Lead for Burlington Ontario Health Team, she evaluated patient and family engagement as a complex intervention and utilized the results of the evaluation to improve diversity among the Burlington OHT PFAC. The Patient Family Advisory Council. And last but not least, we have Tiffany Gartner-Duff, recently began as interim executive transformation lead for the Chatham-Kent Ontario Health Team. She has a master's of health sciences and has worked in healthcare with a systems focus for many years in various project coordination and leadership roles. For the past 2 years in her role as engagement and partnership specialist, she has worked closely with the Chatham-Kent OHT Patient and Family Advisory Council and is keen to share some of their learnings on evaluation today. And also I'd like to call out Laura Tripp as well, who works closely with Julia and her team and has done tons of work to advance the field of evaluation and patient and caregiver engagement in general, and has helped to pull together the session today, along with Michelle Marcineau and Junie Bayek, who are doing lots of work today to make sure the session runs and helped us pull all the materials together. So huge thanks to the broad team that helped to get our session ready for today. And so what I like about the panel fireside chat portion of these types of sessions is we can kind of dig deep into how does this actually look like on the ground? How are Ontario health teams and organizations actually doing this? What does it look like? What does it feel like? And so that's the essence of this discussion now, is to get into some of those details. And I'm going to direct, so you can actually stop sharing the screen at this point so we can see each other a bit better. Thank you, Junie. I'm going to direct my first question to Reham. And Reham, at the Burlington, Ontario Health Team, how have you approached evaluation? So can you maybe walk us through a concrete example on what this looks like, and maybe some of the lessons learned that you've had doing evaluation work as part of that OHT?
Thank you so much, Carrie. Thanks for the intro and thanks for the great question. So, evaluation of engagement is a very big topic, just because I've always seen engagement as a complex intervention. And I've always been saying that to evaluate a complex intervention, then complex evaluation plan. But then you will start thinking about tools that you need for the evaluation plan, and who's going to be conducting the evaluation plan, and what are the resources that you have to do that. So I started by thinking, okay, what do I have within Burlington OHT? So at that time, I do have myself. I do have a strong leadership who were committed to evaluation and performance measurement. And I do have the PFAC members who were pretty interested in understanding if there has been an impact so far or no, because at the time that I joined Burlington OHT, it has been maybe a year and a half of having a full PFAC membership. So it seems to be like the good time. Okay, let's put a plan. So we started by gathering a team. This team included providers, leadership, and the PFAC members. And we started saying, okay, we know that's a complex intervention. What are the kind of questions that we want to be answering as an outcome of this evaluation? And that's to Julia's point. You need to start by question. So we said, okay, if we think about a logic model, we would probably focus on three big areas. What are the kinds of structures and inputs that we had to start the engagement? What is our engagement plan? Were we able to implement it in the way that it was planned? Yes or no, yes or no, yes or no, and why and how? And then what are the processes and the workflows that we had that are related to engagement? And then what is the outcome of implementing these processes if we were successful implementing these processes? And I would just come back to Julie's point about there are two distinctive kinds or forms of outcomes that you would expect from an engagement. You would expect a successful engagement as a direct outcome of engagement as a process or strategy. And you will also think about outcomes that are related to health and healthcare. For the evaluation plan that we started with in Burlington, we focused more on the successful engagement as the outcome. And we tried to define what is the successful engagement. So we used codes from our PFAC. What do you think about a successful engagement? How do you define successful engagement? And we used these codes from the PFAC to identify, okay, these are the goals. And we related them to the implementation plan of the engagement strategy. And we had this list of outcomes that hopefully, if we did a good job, we would approach them. Then it was the time to put the plans and the tools and the team. As I mentioned, it was only myself at that time. So the co-designers were the PFAC members and a couple of providers within the team. And the co-investigators, or people who actually co-conducted the plan with me, were the co-chairs of the PFAC. So we were a team of three. What are the methodologies that we used? We used probably single thing that I've learned to evaluate. So we've done document review, observations, interviews with leaders, providers, and PFAC members, also known as champions within our OHT. And we try to find tools that are easy to implement, easy to analyze, and would be a good fit for the maturity of the OHT at that time. So to answer the question of are we ready or to do this readiness assessment, we use the tool, it's called MORE for short, or Measuring Organizational Readiness to Engagement. At that time, Dr. Ebelson's toolkit wasn't out, so we didn't know that something was coming, so we used what we can. So we used the MORE at that time. However, if someone's going to be conducting this kind of evaluation now, I will highly recommend the engagement toolkit. And to understand the processes of engagement and the experience of leaders and champions with the outcomes, which is the definition of the engagement, as I told earlier, we use the PEAT. So we use the 3 types of the PEAT. So the organizational PEAT, the participant PEAT, and the provider PEAT. And then after we finished everything, we kind of did an analysis across the tools. So we tried to kind of draw this dream. So when the engagement strategy was first planned, how did it look like? And what were the goals? And then looked at the implementation. So when it got implemented, these are the processes that were implemented. These were the facilitators. These are the gaps that hopefully we can fill moving forward. And we looked at the impact from the leaders, providers, and champions, and we tried to find the alignments and the misalignments between the 3 groups. Because in some areas, it might be working like really well in the leadership, but not as well in the perspective of the champions. For instance, the leaders were thinking that we do have enough training, whether the staff or the champions, to do engagement. However, this wasn't the same perception from the champions' perspective. They thought that we need more formal training and maybe a buddy program, so like more of a mentorship program. Some other areas, there was like an alignment between the 3 groups. For instance, we all knew that we don't have enough representation from everyone that needs to be at the table. So we didn't have any visible minorities, we didn't have any racialized groups, we didn't have enough even male to female ratios, we didn't have enough age distribution groups. So these were gaps that were obvious. After what we finished as the process of the evaluation, we had a set of recommendations. The set of recommendations was actually created in a co-design approach. So everyone who was part of the evaluation, whether a respondent to a survey or a participant in an interview focus group or even co-design, and analyzed the data together. We had this set of recommendations, and with it, we had this action plan. Okay, we know that we do need a targeted recruitment plan moving forward. So what do? We need a community engagement plan. At this exact point of time, we were lucky to have an engagement lead joining us. And she is also our communication lead. So this was like spot on. Okay, now we need a targeted plan to a targeted recruitment for people who we've never historically worked with before. And I can say that after maybe 6 to 9 months of this targeted recruitment, we were able to successfully recruit 10 new patient advisors. All of them, 100%, belong to racialized groups within Burlington. This is a success on its own because it was one of the goals that was initially there, but we never were able to. So I think that's the main project that we had. These are the main outcomes. If I were to summarize it in 3 big points, understand your evaluation plan before you actually started. Understand where are you at in the journey of engagement, because you might be further ahead, you might still be starting like as a very small engagement project. So don't get overwhelmed. Think about where are you and then go from there. There are lots of tools, but understand which tool is the best fit at this point of time. And whenever you are having a set of recommendations, make sure that it is accompanied by an action plan, or it's going to be disappointment for everyone who worked on it. Thank you.
Thank you so much, Reham, for walking us through that and commending you for the very early engagement with the patient and family advisors at your OHT to start to brainstorm and think about what an evaluation plan could look like. I think that's so key. And then bringing in other stakeholders along the way, but noting that there are some, disagreements or people might have different priorities, and to be ready for that and open for that discussion. But the accountability piece at the end is really key, is what are we going to do with the results that we have? What's our plan going forward? And I think that's a really important piece to close that loop and keep that learning going. So thank you for taking us through that journey. And we're lucky enough that we have Chatham-Kent OHT here as well. And I'm going to direct the same question to Tiffany. So Tiffany, can you walk us through how you've approached evaluation at your Ontario Health team, what it looked like, and maybe just some concrete examples or reflections to support others, in this audience who are thinking of or are on that journey of evaluation as well?
Sure, no problem. Thank you so much, Carrie, for having myself and Kathy from the Chatham-Kent Ontario Health team. So our Patient and Family Advisory Council has been in existence since April of 2021. So it's been over 2 years now. And when we were coming up to the first year end of being in existence, we started with an informal group reflection for the following year as we were creating our work plan and we were setting our monthly agenda topics for the year ahead. We asked the patient advisors, what do we want to repeat in this next year? What do we do well? And what do we want to do again? We also asked the question, what do we want to rethink? So where could we do better or differently next time that we do these sort of activities? And then the last question we asked was, what do we want to remove? What did not really serve us well? And what do we really not want to do again? So this sort of informal conversation started to get us thinking more about a formal evaluation. And so we started discussing with our Patient and Family Advisory Council, what should we evaluate and who should we evaluate? How will we conduct the evaluation? And what is the purpose or why are we conducting this evaluation overall? And so by looking at it from that angle, because we wanted it to be mutually beneficial. So I'm a staff support to our Patient and Family Advisory Council where, I was really keen to learn where we can make improvements to the engagement of our patient advisors, but it has to be from their perspective as well of beneficial. So I think that was a really important key discussion that we had. And from there, I took the conversation back and I started researching different evaluation tools that were already available. And of course, I stumbled on the PEAT tool, so the Public and Patient Engagement Evaluation tool, which you've already heard about today. We looked at it from the Module B, so the ongoing long-term engagement initiatives. And, what we looked at was some example questions that we were really interested in them. So I brought back the PEAT tool to our patient advisors and said, hey, I found this tool. I think it would be really good. Here's some of the questions. There's quite a few questions, so I'm not going to go over all of them, but let me just read off a couple of them too that we were particularly interested in. We wanted to know if our patient advisors felt supported in their patient advisor role, that their reviews were being heard, that their feedback was being taken into consideration, that they felt that they had the ability to express their viewpoints freely. Did they feel as though by participating in our Patient and Family Advisory Council, it was a good use of their time, and that the work of the PFAC makes a difference to the work of the Chatham-Kent Ontario Health team. And we also wanted to learn about diverse voices and if the individuals participating in PFAC represented a broad range of perspectives. So for these types of questions, the scale that was used it's a 5-point Likert scale. So strongly agree, neither agree or disagree, and then disagree and strongly disagree. And so we've used the PEAT tool for 2 years in a row as an online survey that our patient advisors participate in. And we've had very good response rate in the past 2 years. We consider it our annual evaluation at this point now. The average time to complete the survey for our patient advisors was less than 10 minutes. So it was the average was actually 9 minutes and something. And what we did was we looked at it from the perspective of evaluating their experience on the PFAC participation as a whole. So each of our patient advisors also participate on individual working groups of our OHT and action teams. But if we really wanted to just really understand the PFAC in that sort of meeting space and how people were feeling. We did add a qualitative question at the end to ask more broadly about their participation with the overall OHT, in which we did hear more responses about individual working group and action team participation. So in terms of lessons learned, I think from my perspective, what I would say is that I think it's very valuable to put in the time and effort into designing your evaluation strategy together from the beginning, in the design and in the implementation, and using those results to make improvements. And so it is worthwhile to learn about your PFAC members, especially while we work in a virtual world. So for us, we're having our first in-person meeting in June, actually next week. But I would say, I think, when you typically have in-person meetings, you have parking lot conversations when you're walking to your car, where you kind of debrief with people. Or when you're waiting for the meeting to get started, you're talking to the person next to you about how things are going. And in a virtual world with Zoom meetings, unfortunately, you don't get to have a lot of that engagement. So I think for us, this evaluation was particularly important. Another lesson learned, I would say, is to share the results with everyone. Use them as a conversation starter. We really celebrated what's working well from what we learned from our evaluation. And it was really nice to see and hear some of the comments that people felt about what's really working great and how we can continue doing that. And also to, like I had said, start a conversation about improvements as a group, and then use it also to prioritize where we think that we should start first, knowing that we can't do everything all at once. One last thing I'll just leave you with, and this is from our perspective, I would say, is that we went into it not trying to overcomplicate it. We really just decided to start somewhere, get going, have a conversation about it, learn from other OHTs. We stumbled upon the PEAT tool, and we really went from there. So I think from our perspective, it has been very beneficial. And I would encourage you to also, take an approach that works for your own unique OHT and your own unique Patient and Family Advisory Council. So I'll pass it back to you, Carrie.
Thank you so much, Tiffany. So many helpful nuggets in what you talked about, and totally agree. I think a lot of us feel sometimes intimidated by evaluation work. And I love that you started, with patient and family advisors with some key reflective questions to learn what's working well, where can we improve? And then that led to, a more formalized plan where you involved patient and family partners in looking at the PEAT questions and really digging into what that evaluation could look like. So those early conversations were really key. So I just wanted to highlight that, and thank you for all the examples you provided. So now I'm looking over at you, Kathy, and as a patient partner that I had the pleasure of working with in terms of designing this series as well, and you work closely with Tiffany, I'd love to hear from you what it's been like for you as a patient partner involved in developing evaluation plans and activities, and if you can speak a bit about your experience in doing that and what that looks like.
Thanks so much, Carrie. It's a pleasure to be here, and it's been great, both from the aspect of engagement, working with Tiffany and yourself and Laura and Julia for several years. And so embedding the patient caregiver experience into the process has been really, really valuable from my perspective. Specific to Chatham-Kent OHT, I think Tiffany highlighted the key points is right out of the gate, starting early. What are we going to measure, and how will we measure our success? What will this look like? And how can we make it easy, because we have limited number of resources. We don't have a lot of time to do this. How can we do it well and repeatedly so that we can take that? And so those were great discussions for the whole PFAC and with Tiffany at the beginning. And then we moved into, completing the evaluations. That's always reflective and an adventure, and with an intent that it be anonymous. Well, how anonymous can you be with a small number of people on a PFAC? It still, to me, created that open door, because based on the quality of the results, including the text-based answers that Tiffany collected and collated for us, I have no idea who put what into it, but she brings all of that information collated back to the PFAC so we can look at the information and decide where to go from here, what's working, what's not working. And the extension of that additional question to allow us to get feedback around opportunities within the working groups and the action teams. So I would say that as a group, we have been actively involved through that whole process using the Module B survey. I participate with another Patient Family Advisory Council where we complete a survey after every meeting. Did the meeting work? Did you have what you needed? And so on. And I think both approaches are very valuable, one more in the short term and one in the long term. We've started to have discussions around what else should we be doing, because we're measuring engagement and we're getting growth with the engagement partners. One of the best values Raham already highlighted was in the recruitment process. So as people write down what they're enjoying and what's working about engagement, they start to encourage others that they know, and you get word of mouth spread around in recruitment. And we all need to be able to show these results in order to reflect on how can we bring more people into the engagement space, and especially patient partners as we get worn out. So I think I would have to say overall, Tiffany did the bulk of the heavy lifting on this process, but the patient partners have been engaged all the way along with the process and with the experience. In fact, Laura and Julia attended a meeting with us early on to help us understand how to use the P tool effectively. And I definitely encourage that because it helped with our decision making.
Thank you so much, Kathy. And that was great. And I think, it's just wonderful to hear about what that looked like for you, from your perspective. And the fact that Tiffany circled back with, the things that was shared by the PFAC shows that, the OHT is paying attention. And I think that's the key. And that's the nice segue to my next question is, in the health system, we collect lots of information. We collect information from patients and families and caregivers and, lots of different spaces. But what do we do specifically with the data that we collect? And how do we know if it actually makes a difference? Like, is it actually leading to anything when we capture information, we evaluate something? What actually changes, in the system? So I wonder, directed to you and Tiffany, can you speak to what you do with the data you collect, or maybe what you plan to do with it, and what difference it might make, or maybe what difference it currently does make in the work that you're doing?
Okay, I can start, and I know Tiffany will add additional comments. Some of the information provided in the survey results created very tactical opportunities for us. Things like extending our PFAC meeting from 60 minutes to 90 minutes so that we could spend more time as a group, because as Tiffany mentioned, we're on Zoom. How do you bond? How do you, really work on something when you're meeting in this form? So that actually came out of one of the surveys as an important decision, as well as the importance of getting together and meeting in person. And then the last one that I'd like to highlight was the importance of starting to report back with each other on the work that we were doing so that we could share and leverage the rest of the group. So again, more of the how does the community work together more strongly. These were activities that were identified and completed in the survey. In the most recent survey, a lot of feedback around onboarding new patient partners. And so, opportunities related to onboarding so that we make sure that everybody is well prepared to attend their working group and task team meetings.
Thank you. And Tiffany, did you want to add anything about how the data are used or how you plan to use it for change?
Yeah, I think Kathy hit most of the main things, but a couple of small other things that were really tactical, like Kathy also mentioned, and practical in nature. We had heard that we could be doing a little bit better in terms of our orientation and onboarding, and specifically spelling out acronyms. So this is something that is very difficult when you're new to any sort of group or organization, is learning all the acronyms. And sometimes you can feel a little bit lost and constantly Googling while somebody is presenting or speaking, which can be distracting when you really want to listen to the presentation or what someone is saying. So we've started to talk about it as a group within our own PFAC, because we do it with ourselves, but also with our working groups and action teams as well. And helping each other to politely call each other out, to say, whether it's in the chat or putting up your hand, just asking the question, like, I'm not quite sure what that stands for. And that helps everyone to feel a little bit more welcomed and included and participatory within conversations. We also felt as though what we had heard was that in terms of what's working well, we should celebrate that. And it was really nice to hear some of the qualitative responses. And it makes you feel a little bit good about yourselves and how you work together as a cohesive group, and make sure that we continue to invest time and energy into propelling what works really well for us. And some of the other things that we said where we could do a little bit better on was recruitment for more diversity of our PFAC members. So we know that we don't have a lot of visible minorities and members from racialized groups that participate on our PFAC, but we've talked about it many times about how we can have this within our recruitment strategies, but also reaching out to already existing groups to obtain their feedback for more diversity when we're looking for that feedback on major projects and initiatives. And then the last way I would say that what we learned and what we've already started to do differently is there was a feedback that they wanted to have more greater knowledge and community awareness of our PFAC. And so this is where we've met up with some other PFACs, for example, our local CMHA, so Canadian Mental Health Association, to spell out the acronym for anyone, and to meet up with their PFAC and start to share what we're working on our PFAC. Kathy did an excellent presentation, and we got to learn more about what the Canadian Mental Health Association in Lambton, Kent is also working on, and where there might be alignments in some of our strategies or where we can learn from one another. And just next week, we're going to be meeting with our local hospital, so CKHA, Chatham Kent Health Alliance, to have some networking, but also alignment in some of the work that they're doing. So we're also promoting more awareness through newsletters and on social media about our patient advisors. So like Kathy had mentioned, we've already taken into account a lot of this really practical knowledge that we can do, be making improvements, so that once you know information, you can do better. So we're excited to continuously learn about our PFAC and how we can better support them and make sure that our overall OHT is very inclusive and welcoming of everyone.
Thank you so much, Tiffany, and reminding us that we can learn from other groups. We're here as a collection of OHTs today. You're connecting with other organizations in your region to learn together and grow together and create that awareness. So thank you for all those examples. I'm going to go to Julia now. And Julia, you've worked with Ontario health teams and many system partners for some time. What are you hearing from the field in terms of the key kind of enablers or barriers to planning and conducting evaluation activities?
Thanks, Carrie. I mean, some of it is what you're hearing, in this session, right? We have people who on the ground who are using tools, who are thinking about evaluation, planning, and implementing. And I guess a couple of things. One is this idea of the embracing the culture of learning and improvement, right? I mean, this is about OHTs as a learning health systems, right? So learning through evaluation, through collecting information, as I said at the very beginning of my remarks, that shouldn't be everything else but engagement. We should also be learning and adopting and embracing this culture of learning and improvement around our engagement work as well, even if sometimes that might reveal some things that are not easy to contend with, or some challenges that we face. As the other panelists have shared, right? This can be incredibly helpful. I mean, if this isn't something that we're embracing, like, why are we kind of in the business of doing this engagement and partnering work, right? So I'm pretty vocal about this. You've got to be able to understand the good and the bad, and how to actually improve on that. So it's the curiosity, it's the embracing adopting that culture. There are lots of barriers to it for sure. And I know people in the chat have been commenting on that, the resistance, how do you overcome that? Again, I think that having staff who are very, strong in this area, maybe not who have formal evaluation training. I don't feel that that's actually required. You don't have to go away and take a whole course and, do a degree in evaluation to actually start building it into your work. You may be able to benefit from people who have that, people like Reham. I would also say on the enabler side, OHT fellows, right? The Impact Fellows has been a superb program, and I know Patrick Feng is here. They are a lot. I think I see when I interact with the OHTs, often the glue that brings the evaluation expertise, not just to engagement, to many other things, to the practice, right, on the ground. Reham wasn't herself an OHT Impact Fellow, brings that beautiful combination of engagement expertise and evaluation expertise. Not everybody has a Reham in their OHT, but Reham is also a tremendous resource to the OHT network. So I think it's finding the people who kind of can help you do your work, who can support you, and eventually it's sort of building it up. I don't think you convince if leadership or others in the organization are not buying in or supportive. There could be very, very good reasons for that. Let you know better than I do how strapped you are, how challenging it is in your various contexts to do this work. But I think it's important, really important, to make the message clear that this isn't an add-on, and this isn't just a nice to do, nice to have. Engagement and partnering work is actually central to everything you're doing. So why wouldn't you also build on that really important learning, improvement, evaluation work? So I'll stop there.
Thank you so much, Julia, and reminding us that we're on a learning journey. We can think about this in the context of a learning health system of constant reflection and collaboration, and looking at the resources we currently have to lift the work. I did have another question I was going to direct to everyone, but before we get there, I just want to thank everyone for participating and adding so many great comments and questions in the chat, and also thank our panelists, because I think they've been doing kind of double duty of sharing and answering and going back and forth. And I've just been scrolling through the chat throughout the session as well. And I'm going to pull out some questions. We might not get to all of them, but I'm going to start to kind of move it to the audience directing the questions by pulling from the chat now. And we'll spend about 10 minutes here, and then we'll spend about the last 5 minutes wrapping up. There's a really great set of questions here from Tharanya, and they asked about, what do you do? And I'm going to sort of paraphrase here. When you have limited time, staff, and resources, and we touched on this a little bit, and Julia touched on this as well, but where do you start? Because I think it could, again, we can think of evaluation as being like a big task and, intimidating, limited resources. What's a good starting point? And they said, any thoughts on how we can start shifting organizational cultures to implement evaluation? Maybe that's part 2 of this question, but let's start with where do we start? And I don't know if any of the panelists want to take that on. Kathy.
Yeah, I think this is a perfect example of the limited resources that almost all of the OHTs are experiencing. And for me, the value was in Tiffany and the Chatham-Kent OHT's approach of just get started and plant the trees. So starting with the PEAT tool in Module B, to look at how the patient advisors, what our experience was, and how could we ensure the success of the community in order to be able to grow it. Pick something that you can manage easily and that you can look forward to gaining results from. And then from there, so for me, that's the equivalent of planting a tree, right? It is good, it's not perfect, as Julia described, but it is a great place to start. And then now we have the room, because we're collecting those results, and that's in place to plant more trees. How do we evaluate further the impact? As an example, we've been collecting individual examples, but we probably haven't been effective at measuring where we're having impact or not having impact. And we haven't yet started to collect the experience of the working group and task team members regarding engagement, and what else do they need in order to be able to engage with patient partners successfully. So that, to me, high level, it seems straightforward, but it is very difficult if you don't have the resources allocated to do it.
Thank you so much, Kathy. Would other panelists like to weigh in to that question? How do you start when you have limited resources? Reham?
I don't have a magic answer. However, I think, Kari, that it's always important to build evaluation as a workflow instead of having it as a separate project. So whenever you are implementing a new project, a new strategy, just think about how you can evaluate it at the early on, have it documented, and try as you go, try to think about the resources that you would need as you think about how you're going to be funding any strategy or project you're implementing within the OHT. Or within any big project, think about how are you going to be facilitating, conducting, funding, evaluation, and also understanding the results and enacting them.
Thank you. Thank you. And part two of this question was around, we might be well-intentioned as individuals to do evaluation work, but we really need that organizational support, which could be a bit of a culture shift, for organizations to actually believe that, hey, evaluation is really critical. How do we tackle that one? Because that's big. Julia, did you want to jump in?
Yeah, so something that you'll be hearing about shortly is kind of a set of competencies, right? And this idea of building engagement capable OHTs. So I think what we're hearing today, and certainly I would share this view, and I think many others, is the real importance and the foundational role that evaluation plays. And evaluation, including evaluation of all of our engagement and partnering work. So maybe we think about building competencies around evaluation. So having who is the point person in the OHT or partner organizations who will actually have some expertise, who has done some training, who has come to these, taken in this particular segment of the engagement learning series, like really thinking about this at a competency level. And I think that will take an important step. So you're going to be hearing more about competencies and enablers for engagement capable OHTs very soon. There's a resource that we've been developing and are ready to release it actually later this week or early next. And we have actually placed evaluation at that foundational level as one of the competencies that OHTs need to have.
Thank you for that, Julie. I think that it's going to be a game changer in terms of starting to shift the culture within our organizations and helping people to skill build in that area to support the evaluation activities that are happening. As I continue to scroll through the chat, I see, and I know some of these have been answered, but they might be worth reflecting on. We have turnover with, patient, family partners, community members. And there's a couple of things related to turnover is, how do you evaluate sort of changes when that kind of contextual thing is happening? So, but also, how do you find out maybe why people left? Like, is there something and Alex hit on that, like, is there something to learn about the turnover itself and what that means for the work that you're doing? Would anyone like to tackle that one? I think Kathy, yeah.
Yeah, I think it's really important to understand what and why the individual is leaving or departing from either their role within a working group or within the PFEC as a whole, or as a patient partner working on any other project. And what are the contributing factors? Much like an HR exit interview, right? How can we learn about what's working and what's not working? And in many cases, you may find that there are very personal stressors that are pulling people away. But in other examples, there might be reasons like, I never felt I was getting any value, having any impact. So the how will we measure impact can come out of that discussion. It really, from the ability to create the exit interview and to learn without putting the patient partner into too much stress associated with having to explain why. There's a lot of contributing factors. We need to understand them.
Thank you, Kathy, and great examples. And I think Junie, she's been directing some more questions my way. And Wendy had a set of interesting questions as well, highlighting that, a lot of the measurements tools that we use, they don't necessarily have common elements. We might be using different tools. How do we bring more consistency across the board, but also allow the data collected to be shared more readily? So I wonder if this is getting at like a common data set and how to share, but also how to store it appropriately. I think this is getting at, how we manage the data maybe, like, is this something we need to think critically about in terms of how we manage what we collect? There's a whole bunch of things in there, but anyone like to, Julia, do you want to tackle that one?
Sure. I saw that in the chat, and I didn't want to distract too much from the panelists, right? So I kind of held off on that one. I guess partly it's a question of, are you looking for that consistency within, your OHT and thinking about that as you do your evaluation work, or were you getting at, I don't know if you were hinting at something across OHTs. I think both is possible, but obviously the across OHT is a much different, kind of a thing to consider. Certainly our tools, the PEAT, and I think you heard, Tiffany and Kathy talk about this in their content, like the whole point of using the same questions, the same tools, it's to do those repeated measures, right? The importance and I think Reham put something in the chat about the importance of that from a validity perspective, right? So I do think consistency. So don't start grabbing, oh, here's a new one, I'll use this. Like, try to think again, practically, but also, intentionally about what are the core tools? What are the core questions? Okay, we want to add something qualitative, like, Tiffany described, but try to, really stick to some basic sets, not a lot, but, a basic set of questions that you're going to ask in a kind of repeated, consistent way. And that's going to help you understand and build up your evidence base and your information about, to help you plan for and maybe move in some new directions. So it kind of depends. I wasn't sure if Wendy, you were getting at the across the OHT or within. So anyway, happy to follow up with you separately if that's helpful at all.
Thank you so much. And I'm looking at the time, and I never know where the time goes in these sessions. They really fly. But what I wanted to do is and I apologize, I know I didn't get to everyone's questions, but we're happy to follow up to answer them later. Just a very quick roundtable from our speakers. One crisp takeaway that you want to leave the audience with today based on maybe something we've discussed, or maybe something you haven't had a chance to say yet and you just want to get it out there, but very crisp. And then we're going to do a quick Mentimeter with the broader participant group. Who would like to go first? Julia, do you want to go first? You can
Sure. Sure. I think I'm kind of paraphrasing or quoting Tiffany, like, just get started. Don't let kind of perfection get in the way of just getting on with things. There is no magic solution. The chat is coming up with great ideas, exit interviews. You know this, you've got this, so just get going.
Thank you. Tiffany.
I think that all of us as OHTs, we're on a learning journey, like you said, Carrie, and I think it's a commitment to understanding and reflecting, and in that way, it's beneficial to everyone that you can understand and then therefore make improvements. So, just to echo Julia as well, like, just start somewhere. I saw lots of great ideas in the chat. Everyone is unique in what they might want to learn more about in terms of their impact or engagement, and just go for it.
Thank you, Tiffany. Reham.
Engagement is very valuable. So it's very precious to be just an add-on or to be good to have. Evaluation is very important, not just to say if we're doing the right thing or no. It's more about understanding how to improve on a continuous basis.
Thank you, Reham. Final word from Kathy.
So if I could, share this with everybody that I work with from an engagement perspective, share the outcome. What happened? What are the results that you've collected? and how can we use this to make to find opportunities for improvement and to stop doing the things we don't need to be doing. So really, back to what Tiffany said, review and reflect, but share it with your patient partners so that they can learn and grow and feel like their contributions were valued.
Kathy, thank you so much. What a great way to end this panel and this discussion. So solid. And I thank all of our contributors today in the design of the session and this lovely, awesome discussion that we had that hopefully will inspire others as we're all on this evaluation journey together. If I can keep people for a few more minutes, we are going to flip over to a Mentimeter. We have 3 very quick questions to ask you based on what stood out, what you want to learn more about, and also how you might apply this to your work with Ontario health teams. If you go to www.menti.com, you can type in the code 8587-4437. And when you do that, you should see the question that's up on the screen right now. If Menti is not working for you, you're welcome to put some ideas in the chat box instead. So you can use the Mentimeter, you could use the chat. Junie put the link in the chat box and I can see the results coming in. What stood out as most helpful, just start where you're at, just get started somewhere. The tools, we learned about so many practical tools today. And of course you have the workbook, which highlights many of those tools with links. Have ongoing check-ins, absolutely. What's working well, where can we improve? I heard those questions today. Just start somewhere and don't overcomplicate it, absolutely. Context matters. Yearly patient and family advisory council check-ins, so it's co-designed. Yeah, we heard a lot of examples of that. Practical tools and experiences from other Ontario health teams and Julia's work, so we can learn from each other. Overview of current tools and approaches were helpful. I agree, co-design of evaluation with patient advisors is key. Just get started, make it simple. Okay, so you can keep responding to that question. I thank you for your participation there. We're going to head to the next question, which is, what would you like to learn more about? So we envision that we'll have, future webinars, maybe a 2.0 version of this engagement series. But when it comes to evaluation in particular, what would you like to learn more about? And thank you, Sharon. Get the results back to those who gave input. That's critical, and the piece, I guess, that stood out for you and for me as well. Overcoming limited resources. Yeah, so to dig in more on that. Exit interview examples. Great suggestion. Prepare for entry and exit interview. So how to prepare for that. The best way to engage in evaluation. Surveys are not always the best, agree. So having the ongoing reflection, focus groups, different types of having coffee together, a meal, learning and sharing are other ways. Diversifying engagement and evaluation. So learning how to do that, how to evaluate equity and engagement and equity impacts of engagement. Yeah, where are we at this time? Self-evaluation tools and resources. More presenters who talk about their PFAC experience. I agree. Yeah. How to overcome the barriers by ensuring facilitators to engagement within the organization. Okay. Yeah. Great examples. And just one more quick question. I can never keep to time. Provide one concrete example. This is a tough one, but maybe not, of how you will use this work in your OHT. And of course, we do have a follow-up survey that will show up on your screen when you exit today. And we'll also provide a link when we put the slides up again, because we probably will go about 2 minutes over today. But if you'd like to answer this question, provide one concrete example. The tools, the stories. Yeah, great. Lots of great tools out there. And huge credits to Julie and her team for all the work they've done to create tools for everyone to use. Yeah, reviewing using the tools, fantastic. And that Engage with Impact Toolkit is phenomenal as well. Yeah, very practical, fairly easy to administer. Reconsider PFAC evaluation and exit interviews. Yeah, standardized PFAC evaluation, informing how we're doing with our building and evaluation strategy for our client table. This is great. It sounds like those who responded are really interested in taking a deeper look at the tools and potentially using this in your evaluation work and expanding your evaluation strategies. Okay. So I think what we'll do is we'll go back to the main presentation, but you can keep your responses coming. We'll keep a record of that. And I just wanted to quickly highlight just a couple of things. It's kind of a momentous day because this has been a huge series in the making. You know, we spent a long time developing, planning, thinking through, and then eventually executing the full 7-part series, which concludes today. But there will be a 2.0 version. So we'll figure out what that looks like, and we'll learn how to design that based on feedback that we continue to get from all of you who've attended maybe one or more of these sessions. You'll be emailed these registration links. You're welcome to pop in. It's in the chat as well. You can pop in to one of these times. If they don't work, I'm happy to meet with you separately. We just want to learn what worked and where can we improve. 2 really great reflection questions that we also talked about today as using in your OHT and organizational work. So just we'll flip over to the next slide. We did the Mentimeter. If you with a few quick acknowledgements, you can go back, sorry. Just wanted to recognize all the different groups across the ministry and OHTs and our research team who have supported the work all the way through. And there's another slide with many, many names of individuals who have participated to help think through, design, and execute the learning series that we have. And there's many more to add to this list as well. And over to the next slide. Thank you for attending. We will put up that screenshot slide again if you wanted to click on that QR code to fill out the survey. You can do that here. You can do it when you exit. There's also a link at the bottom of the screen. But I just wanted to send such a warm thank you to everyone for supporting this, for showing up, for engaging, for asking great questions. We're all on a learning journey together, and it's just been such an enjoyable experience to be part of this initiative with everyone. And I'm so grateful for everyone's willingness to share their expertise and their ideas and openness. And that's exactly what we're trying to cultivate in these sessions. So thank you so much. And I think Irene has her hand up, so I'll go over it. And Irene's been so pivotal in coaching us through this. So thank you, Irene.
Oh, listen, we cannot end this final session without a huge thank you to Carrie. Your leadership throughout this entire process has been phenomenal. I think we all should give a standing ovation. Yay! To Carrie, because you have just been so collaborative, compassionate. You've involved people from all across the province, and you emulate in your leadership what patient engagement is all about, Carrie. And I just personally want to thank you because you've just done an amazing job. So we look forward to your feedback sessions as well as a 2.0 because this is such important work. So thank you, thank you, thank you from the top, bottom, and middle of my heart.
Thank you, Irene. You know that your words mean so much, and your support and mentorship all the way through this has been phenomenal. And I was lucky enough to receive that support mentorship from Irene, from Kathy, from many other patient family partners across the province, and lots of the participants here and other members of OHTs and organizations who have given us really great guidance and feedback. I've learned so much. We've all learned so much in doing the session together. And yeah, I don't want it to be over. So there's going to be a 2.0 and a 3.0 and a 4.0. And I look forward to continuing to learn together. So with that, 5 minutes over, but I'll officially close the 1.0 version, but 2.0 is coming at you really quick. So thank you again, and I'll see you all soon. Take care.